Hi all, Tony here from Immortality IMT, cryptocurrency for the longevity field. Today we have an old one, reversal of grey hair, titled Repigmentation of New Growth of Hairs After Anti-Interleukin-17 Therapy with secukinumab for Psoriasis. Another anti-inflammatory. This one's in Science Direct. This is an old one. There's some newer ones out, but let's give it a read. Repigmentation of hairs is a rare event that has been reported after inflammatory process exposure to X-irradiation and cerulean and ultraviolet A electron beam therapy and the intake of some drugs. We report on a patient with psoriasis who experienced darkening and noticeable increase in scalp hair while he was receiving anti-interleukin-17 therapy. Case report: a 61-year-old man with a 2-year history of plaque psoriasis treated early with topical steroids and calcipotriol was referred for a flare-up of his skin disease associated with a weight loss of 10 kilograms. He had arterial hypertension for which he had been treated with valsartan and hydrochlorothiazide for 7 years. A histologically confirmed erythrodermic cirrhosis was diagnosed, affecting 90% of his body, including the scalp. With a psoriasis area and severity index score of 41, the patient was administered secukinumab that induced complete clinical resolution at week 12. With region of the original weight as a young man, the patient had brown hair which began whitening at the age of 45. After 6 months of therapy with secukinumab, the patient, who also had androgenic alopecia type 2 and 3, noticed that his scalp hair, which had been totally grey and white for 10 years, figure A, was becoming darker over the entire scalp with a diffused increased hair density of approximately 15%. And figure 1b. So as we can see, we have some interconnection with the immune system, some interconnection with hormones that are dictating what the hair color should be, how that whole system should behave. Trichoscopy confirmed hair repigmentation with some vellus hairs. The patient remained on secukinumab therapy with persistence of hair darkening after a follow-up of 10 months. So that's a pretty amazing reversal of condition. Reversal of conditions happen all the time in medicine, but they are often discarded as anomalies. They often go unresearched, but they do happen, and nobody really knows why. After 1 month of therapy with secukinumab, the patient's hairs were still grey and white, and there was a marked improvement of this erythrodermic psoriasis. 6 months after secukinumab, the treatment pronounced hair darkening of the scalp with increased hair density, total skin clearing, and regain of the original weight. So psoriasis is an autoimmune disease. Discussion: repigmentation of hairs has been associated with the intake of various drugs, including latanoprost, thalidomide, lenalidomide, para-aminobenzoic acid, corticosteroids, cyclosporine, L-thyroxine, verapamil, taxoxerfin, levodopa, cisplatin, retinoids, and most recently with targeted anti-cancer therapies. So they've given you a whole slew of drugs where this repigmentation has occurred. Most of the reports include anecdotal cases or case studies, and the lottery period between the drug intake and the repigmentation range from 3 to 12 months. In particular, in the setting of targeted anti-cancer therapies, hair repigmentation has been described as an effect secondary to immunotherapy with anti-PD-1 and anti-PD-1-L1 therapy in 14 patients, 30 men and 1 woman, mean age 64.9 years, who underwent treatment for lung cancer in opposition to the vitiligo reactions that developed during melanoma treatment. So vitiligo is also an autoimmune disease. There's no pigmentation of the skin rather than a lack of pigmentation from the hair to the hair. But this all implicates the way the immune system functions and the way it interfaces with other aspects of the body, but namely the stem cell system. This hair repigmentation consisted of a diffuse darkening of the hair in 13 cases and in black patches between white hairs, and in one case. In a case series of 133 patients with a chronic myeloid leukemia treated with imatinib, 9 patients, 5 men and 4 women, median age 63.4 years, also had progressive repigmentation of their grey hairs on the head in 8 patients and on the body and head in 1 during treatment. No sound pathogenetic explanation was given in these 2 reports. Removal of the inhibitory effect on melanogenesis by tumor necrosis factor, TNF. Alpha has also been suggested for the unique case of repigmentation of hairs that occurred in a patient with rheumatoid arthritis after treatment with adalimumab. Okay. So, removal of the inhibitory effect on melanogenesis by tumor necrosis factor alpha has been suggested. There's a little theory there. In the setting of psoriasis, darkening of hairs has been reported with retinoid therapy and cyclosporine. Darkening of hairs after retinoids have been related to a drug effect on melanocyte stem cells localized in the bulge, sub-bulge area, and to follicular keratinization. In particular, Wang et al. Reported that retinoid X receptor alpha, a retinoid nuclear receptor that mediates retinoid activity at the molecular level and is highly expressed in the skin, may modulate the skin keratinocyte and melanocyte homeostasis via autocrine and paracrine signaling. That's interesting because hormones have a crining or crinning effect to the epigenome, to the chromatin. As for darkening and thickening of hairs caused by cyclosporine, it has been suggested that the drug may promote the production and growth factors of cytokines, which are capable of stimulating tyrosinase activity. In our patient, we attributed his hair darkening and thickening to increased antigen growth phase as a result of a changed immune control over the hair cycle, removing the inhibitory influences of IL-17 after secukinumab administration. In fact, IL-17 may increase the synthesis of anti-melanogenic cytokine IL-6 in cultured normal human melanocytes. Moreover, a synergistic effect on the melanocytes from IL-17 and TNF-alpha, both inhibiting repigmentation-related signaling and melanin production and inducing keratinocyte production of B-defensin 3, an antagonist for melanocortin-1 receptor, which have been described. When considering psoriasis skin lesions that overexpress pro-inflammatory cytokines such as IL-17 and TNF-alpha, a decrease in pigmentation signaling and pigment gene expression is observed that can be neutralized by a therapeutic administration of TNF-alpha and IL-17 inhibitors. Actually, blockade of TNF-alpha and IL-17 resulted in a restoration of pigmentation, gene expression, with the occasional appearance of speckled lentigo-like lesions in resolving plaques of psoriasis. Graying of hair is considered a progressive and permanent process associated with aging caused by a melanocyte depletion that usually begins between the mid-30s and the mid-40s. The possibility of repigmentation of hairs could be related to clinical healing of psoriasis on the scalp as a post-inflammatory effect has also been taken into consideration, but hair darkening in our patient was observed in all areas of the scalp regardless of whether he was affected by psoriasis. Moreover, our patient did not undergo any cycle of therapy with retinoids, cyclosporine, or TNF-alpha inhibitors, which could have played a role in inducing the hair color change. We also considered that the increase in hair density could be caused by weight gain and improvement in health, as it occurs after a resolution of a telogen effluvium. However, no previous history of massive hair loss has ever been reported. Hair darkening and regrowth after administration of some drugs suggests that hair whitening and thinning caused by aging process might be reversible. So this is a proof that grey hair can be reversed. It's $1 trillion product. It's possibly easier than those highly successful hair loss products that have recently been put on the market. And the process is mostly well known. We have an interest at Immortality IMT. We have an interest in this kind of product. We think we can version a pill that will be effective for some people and not others, and then improve the formula over time. Which would be a $1 trillion product for Immortality IMT, which will go back into buying the crypto and replenishing the grant fund. So, Immortality IMT, get on down to the website and buy some tokens before it goes parabolic. What do you think? Repigmentation of new growth of hairs after anti-interleukin-17 therapy with secukinumab for psoriasis. There are other reports with other means, and we'll bring those to you in a while. Okay, bye-bye.